Okay, can we hear him now? Can we hear him now? We're going to try to head back out to Big Budah again. He's at the Intermountain Health Center in Murray.
Yeah, Budah, how's it going now? You giving it the old college try?
And wow. John, let me just say, it's not a love connection. You don't come down here because you want to hook up with other people who have healthy hearts. That's not. although you could network, right, Sarah?
There'll be lots of people. So.
Now, one way to kind of assess it is this thing that you have is the My Heart Health Passport.
Absolutely.
Break it down for me.
Okay, so you're going to go in here and just answer lots of questions about your risk factors, your height, your weight, your family history, whether or not you smoke, your blood pressure, lots of things about your health, and we'll help you figure out if you're at risk for diabetes or for heart disease.
So if you go through the whole pamphlet and you answer the questions honestly, it should give you a rough assessment or a pretty accurate assessment.
If you're at low risk, you can keep learning about things at the fair. If you're at high risk, though, you'll move on to some other screenings today.
Well, I'm not opposed to answering some of those questions so we can so we don't scare people. Let's answer some of those questions.
Sure. So this one is about your age and gender. So how old are you?
Yeah, let's go with the first one. I don't really like putting my age out there. Yeah, we'll go with the first one.
Okay, so you say you're 44 or younger,
Yes,
so that would give you 0 points for age.
Okay.
What about your physical activity? Do you walk at least 5 times per week?
Yes.
You do. Okay, so then you get no points for that either. You're doing well.
So no points, you want no points.
You want no points.
All right. So John, just from those two questions, Kel, would you guys be scoring points or would you be scoring no points?
You know, unfortunately,
Yeah.
I do not do enough walking or exercise in general. So.
Oh, so you're like 10 points.
Yeah.
You got me
that's not
there,
good.
Budah.
10 points in this case is not good, Kel.
No.
John, what about you? We'll end with the segment with you. What?
Yeah, I think I'm in the positive category there.
Okay, they're not good.
Yeah.
Your passport just got denied, buddy. Yeah, you're getting deported back to unhealthy land. That's what's
I
happening.
know, you're right. But now, you know.
No, look. Now, don't worry. We're out of time. When we come back, we're going to give you tips and advice on how to make your points go down and have a healthy heart.
Sounds
Sarah,
good to
thank
me.
you so much.
Thank you.
Yeah.
All right. See you guys in a little bit.
Okay, thank
Heart
you,
Healthy
Budah.
Expo. Fair.
Important
What-
information.
Yeah.
You know, heart health always, you know, has been, I think in the past, a focus on men, right? Men and their hearts, but women now, that's the leading cause of death among women. Heart disease in general.
Hard to believe,
so.
but that's that.
Yeah, I've got to get walking.
That's
I know
right.
I do. All
That's right.
right, good tips from Budah. All right, we'll head back out to him. It's a week of love, isn't it? Valentine's Day is this Friday.
Right.
Yeah, we want you to stop, take a moment though, and concentrate on yourself. It's all about you and Budah.
That's right. I guess this morning, instead of thinking of others, there's another way to think of others by thinking of yourself, I suppose.
Good way to put it.
Yeah. And Budah, you're down at Intermountain Healthcare. Is that where you're at?
Yeah, big heart healthy
that-
fair.
Is that help me help you or help me help myself?
Help me
what
help
thing is it?
you. Wait,
Help
help
me.
you, help me, help you.
Help.
It's
and
a
be
mutual
helped.
feeling.
It's a mutual feeling. Okay. All right. So here's a pop quiz. Here's a pop quiz. Take a look at what Bob's doing. Okay. And then take a look at what I'm pretending to do. Okay.
Okay.
Oh, bad Budah.
Which do you, no wait a minute. Which do you think is more unhealthy? What I'm pretending to do, or what Bob is doing?
I would say what you're doing.
What I'm doing, John?
Pretending to do.
Well, for your heart, I have no idea.
No idea. Okay, Bob, let's answer that question. So I was just simulating, pretending that I'm smoking. You were just sitting there on your laptop. What is the answer?
Actually, it could be just sitting there. That could
Seriously?
be the less healthy issue, yes.
So would you say that sitting is now like the new smoking, if you will?
Well, that's something you could learn about at the Heart Fair today, because we do actually have somebody talking on that topic, and yes.
See, Bob also understands that if he gives you all the information on TV, you won't want to come down to the fair. You are a smart man. That's what I'm talking about. All right. So tell me some of the classes that people might be able to come and experience and learn about.
Come over here.
Okay, what do you got?
Well, we got, as you talked about, we've got the new smoking, which may be sitting. And so we have somebody talking about that, a couple of people. Dr. Liz Joy and Dr. Tamara Sheffield are going to be talking about that today at the Heart Fair at Intermountain Medical Center at the Intermountain Heart Institute. So one example, you could actually be on a treadmill and doing work. So what I was doing earlier, sitting in that chair, I could actually do on this treadmill, and some of these types of things are available in some businesses around the around the city.
Are you learning that more and more businesses are using equipment such as this to keep them active and working?
Absolutely. They're finding ways for people to be active. They're encouraged walking meetings. You can actually talk to somebody while you're walking and get a lot of work done and get a little bit of movement and exercise at the same time.
Yeah, yes, Kelly, I heard exactly what you said. Yes, at the gym, I would be playing the part of John, and Bob would be the part of any unsuspecting young lady. So, do you come here often?
Yeah, I do actually. Yeah.
That's a nice treadmill. That's a nice treadmill. Is there room on your treadmill for two?
No, but we can take turns.
Okay. Well, we're going to do something that nobody has ever attempted. We're going to work both on our hearts at the same time. Move up a little bit, Bob. Move up a little bit. Look at that. Look at that. We're both healthy for our heart. Nobody has ever done this in the history of heart fairs. Yes, that's what I'm talking about. All right. We're going to come back. That was dangerous for our legs, but not for our heart. All right? Lots of things, lots more to come. It all kicks off at 9 o'clock, and it is free.
It is free. Everything's free.
All right. We'll pound it right there. All right. We'll be back with more. John, I got your back.
Thanks,
but not
buddy.
your side. Just your back.
You've given me ideas. That's what I like.
Little tips.
Bye, Kel. See you
Amazing
guys.
what you could learn. Thanks, B. Good information there. Back out to our very own Big Budah, joining us for a Saturday morning because there's a really cool free Heart Healthy Fair going on.
That's right. It starts at 9 o'clock, and Budah's there early to give us a preview.
Yep, starts at 9 o'clock, and one of the really cool things that I love is that you have experts at your beck and call. Dr. LePay here, you can go right up to him and ask him a question. Now, I'm just going to ask him a question that I have at the top of my head. Dr. LePay, can you talk about the effects that obesity might have on someone's heart, the condition, the state of their health of the heart?
Great question, because half of heart disease can be prevented by just improving lifestyle practices. And you're a great example of that. By the amazing feat that you've achieved by losing the weight you have, your risk of heart problems has significantly reduced. For instance, your blood pressure probably went down 20-30 points. Your risk of diabetes has been reduced by a third. You're able to get up and around better. You sleep better, less risk of having sleep apnea. Your cholesterol has dropped by 30%. All these features have improved just by losing weight. Now, don't forget, no matter what weight you're at, regular exercise still contributes to improved outcomes. So continue exercising no matter what weight you are.
Now, will you answer any questions during the health fair? If somebody comes up and says, "Oh, I saw you on TV this morning. Can I ask you a question?" Is that going to be a possibility?
Not just myself, but many members of the Intermountain Heart Institute are here to answer the questions from the public, so everyone can be aware of what they can do to prevent any heart problems.
Well, Dr. LePay, great information. We're going to talk to him in the next segment. We're going to talk about blood pressure, how important that is. Now, one of the things when I hear about obesity and overall health is your fat percentage in your body. How John, don't laugh. I know you're thinking, how fat am I? Yes, that's what I want to know. What is your name?
My name is Michelle Dutton.
All right, so Michelle, I'm going to do this test, and you tell me what's happening, okay?
Sure, will do. It's called bioelectric impedance. It's sending an electric impulse from one arm to the other arm. I'll have you put your thumbs on the very top up here. Arms out nice and straight. It's sending an electric impulse from one arm to the other arm. It's measuring the resistance against muscle, water, and fat. It's putting it in an equation with the information you gave me, your height, weight, age, and gender, and then it's giving you percent body fat, and it's done. You're right. It's absolutely done.
I am not very happy. It says very high.
Yeah.
Look at that. So now you've seen results before. Tell me, what do you think about those results there?
That's, it's a good result. The healthy range is for men to be between 10 and 25%.
I don't think that's accurate.
It is. It's not. It's a great number to look at and a good baseline to keep going.
So wait, am I reading this right? I'm 35.8% fat?
Yeah.
Dang, how fat was I before? Holy cow!
And we've seen people up to 50%, so that's look at that.
Way to put a positive spin on that, Michelle. Thank you so much. You too can find out just how fat you are, because if you don't know, you can't help yourself, right?
Exactly.
All right, we'll see you guys in a little bit. We're coming back with Dr. LePay, and we're going to do blood pressure. How important is that to your heart? I don't know. Let's find out when we come back. Say goodbye.
Goodbye.
Excellent.
Awesome.
Thanks, Budah.
And look at how far you've come, Budah. We're proud of him. Very proud. Yeah, and he keeps going down as well. All right, we'll check back in with him. All right. Well, Big Budah is out. He's warm at Intermountain Medical Center, kind of warming up his heart. He's been exercising, getting all sorts of tests done to see how he's doing.
He just came back. He had this cool little machine that showed how much fat you have in your system, and now you're going to do blood pressure. Is that what you're testing?
Yeah, John, stop stressing me out. I'm trying to calm down.
Oh, he's trying to calm down.
You're trying to lower it.
Don't raise his blood pressure.
I don't even know if that works. Does that even work,
Yeah,
Dr.
does that
LePay?
work?
Yes, yes. So even relaxation exercise and reducing stress can lower your blood pressure.
Okay, I didn't really believe that, but okay, now that I've heard it from a doctor, I'm going to take that more seriously. Now, talk about blood pressure, the overall. How much does that pay as far as the overall health of your heart?
Blood pressure is a critical factor in the health and how your health and heart works. Your heart pumps all the nourishing blood throughout your body, and how hard it has to work is determined by the blood pressure. If the blood pressure is high, then above 135 over 85, then your heart's having to overwork and it can wear out.
Now, how often should you go get your blood pressure checked? Should it be part of a routine? Should you do it all the time? If you do something, like let's say you fall down, you have an accident, is that cause to go get your blood pressure checked? What are some tips?
Everyone should know their blood pressure, and it should be done several times a year. And it's the average blood pressure that matters, so know your blood pressure. And if it's above 135 over 85, talk to your doctor.
All right. So Tim here, he's done. I asked. To me, it's a dumb question. Tim said it's not a dumb question. I'm going to re-ask it live on television. How many blood pressures have you taken?
Many thousands over the decades.
Yeah, many thousands. I thought I was going to outsmart Tim, but no, he knows a thing or two when it comes to blood pressure. So what are we looking at? What are you seeing here?
Well, I'm seeing an error message on our machine right at the moment here.
Oh, you just proved John right. I'm a vampire, John. You're right. Yeah, there's no blood pressure because I have no heart. Therefore, I'm a vampire. No, there's just technical difficulties. Now, while we're working on this, can you tell me about this passport here? Blood pressure is part of it, correct?
Yes. Blood pressure and heart rate, body fat. We're doing some oxygen saturation screening today, but people are getting a variety of screenings done, and then they will get points depending on what those values are. And people who are at a bit higher risk, we're going to send them off for a bit more care and deeper screening here at this event.
Now, I just want to preempt that normally people don't take blood pressures and talk on television, so if it's a little elevated.
That's right. You're not supposed to talk when you're having your blood pressure checked. And that's one of the things we would instruct a person while they're having it done is not be talking.
All right, we got results, and according to that, Doc, I'm going to refer to the doctor here. Those are the numbers. What do you think?
Too high.
Too high? Well, I am talking on television.
Right. Well, you have to take several blood pressure readings, but you should bring in the multiple blood pressure readings to your doctor. About 10 of them would be very helpful. And on average, if it's above 135 over 85, then discussion about lifestyle changes more aggressively. And then if that doesn't control the blood pressure, there's some very effective medicines that have almost no side effects that really can prolong life, because high blood pressure will reduce decades from your life.
Okay. Well, Tim, thank you so much. Dr. LePay, thank you so much. You know what? This is really causing some concern. I know it's for television, but I think a EKG is in order. I think I need to get an EKG. Is that okay?
Perfect.
All right. Well, I'm going to go get an EKG. I'm very concerned about this. This is very troubling. John, Kel, back to you.
Yeah, mine's a little elevated. It's scary to think that you're wearing your heart down a little bit.
Yeah, you got to keep yourself healthy. We need you around. Big Budah is up and out early on a Saturday morning. He is telling us all about this really cool free heart healthy hair. You're getting checked out yourself this morning, Budah.
Yeah, and you know what? We're not just doing this just for television. Actually, I'm talking to Dr. Muhlstein here. If you've gone through some of the other screenings, like I did, I had the fat body test, I had the blood pressure test, and if you don't pass enough of those screenings, then an EKG is recommended. Correct, Dr. Muhlstein?
That's correct, because that puts you at risk for cardiovascular disease, and the EKG is something we can do to start to determine whether or not you maybe already have some cardiovascular disease.
Jake, go ahead and run the EKG here. While Jake is running the EKG, what does the EKG mean? How does that help me as a patient?
Well, what the EKG basically does is shows us the electrical activity of the heart. But if you have had a heart attack, then there's no electrical activity in that part of the heart, and so we can determine that by looking at it. It also lets us know what your heart rhythm is doing to make sure you don't have an arrhythmia like atrial fibrillation or ventricular tachycardia or something. And then also it can give us indirect signs about whether your heart's too big or too small, because it changes the amount of voltage that part of the electrical cardiogram does.
Do me a favor, I want to show everybody at home what it looks like, because it doesn't make any sense to us, obviously, because we're not trained, we're not doctors. But looking at that, Kelly, John, what do you see just by looking at that? Just give me your first impressions.
Oh, I see high points and low points.
I see
High points and low points. Thank you.
Regular heartbeat.
A regular heartbeat. Thanks, guys. You're so helpful. Thank you. Let's refer to the professionals. Yeah, no, always got my back. Thank you. Let's ask Dr. Muhlestein. So what do you see as a professional? What does that tell you?
Well, I see some good things and some not so good things.
Okay.
Some of the good things I see is there's a regular beat all the way along, and then there's a little blip in front of each of the big blips, which means that you have what's called normal sinus rhythm. So you have a regular heart rhythm. But then I start to look at the little intricacies of it, and one thing I see is that this little blip is supposed to get bigger and bigger and bigger as it comes along here, and it doesn't. And that's called poor R-wave progression. And that's a sign that you may actually have some sort of lung disease. And it especially sort of gives an indication that you may be having what's called sleep apnea.
I do have sleep apnea.
And so the electrocardiogram kind of confirms that and says the sleep apnea that you've had in the past, understand now you're actually treating it. Is that right?
Yeah, well, I've had sleep apnea for a while. I've been sleeping with a CPAP, so that's nothing new. But what would you recommend now? What do I need to do?
Well, what I'd recommend you do is keep losing weight as you have done. Weight increases the risk of sleep apnea. And also use your CPAP mask, and you may be able to prevent any further progression of problems. This demonstrates that there may be a problem on the right side of your heart, and that has been the common sort of thing that happens with sleep apnea, but it's not severe. So you've caught this soon enough, and as you now address the things we found on the electrocardiogram, you're likely to live for a long time.
And that's what the Healthy Heart Fair is all about. You can come here and get information you may not know, and knowing is half the battle. It starts at 9 o'clock, it goes to 1 o'clock, absolutely free, right here at the Intermountain Health Medical Center. So come on down. Dr. Muhlestein, thank you so much.
My pleasure.
Thank you so much for not shocking me, and we're going to send it back to you. Kel, John, hope to see you here.
Wow, Budah, some interesting info. Thanks for sharing that.
I'm
Yeah,
unhealthy.
we appreciate that. That was really interesting.
Yeah, he better stay well. He's going to be on this morning show for another 100 years, so we need
That's
him
right.
around.
Hopefully.